There you go. Good. Nice and easy on that. Good job. That's set real nice.
Yeah, nice crack.
Yeah, that's a good crack. There it is.
Hey, yo.
So, all right, let's go ahead and take a look at what's going on. So, I heard we had a couple of falls.
Yeah.
What happened? Tell me what.
Well, the first part was picking up a scrunchie in a damn bathroom. You know. I can lean forward, but I think it's when I lean a certain way to pick it up, like at an angle or something.
Yeah.
That's when I get that pinch right here.
Yeah.
And when I get that, it's like, as soon as I felt that pinch, that's when I almost caught myself, and that made it even worse.
Oh, so you were actually getting something on the floor.
Right, the scrunchie fell on the floor in the shower.
Like a pinch there.
Before I was falling, I caught myself.
Okay.
And then that's what caused this episode.
Gotcha. Okay, so it wasn't the fact that you had fallen and now we have back pain. It was actually that you had an existing thing going on.
Right.
And that kind of led to the fall.
Right.
Okay. You have two issues, right? So one, the disc spaces should be nice and thick. Those are what you call discs, so they're kind of like cushions for your spine. I don't really like to use the word cushions, but they are kind of like cushions. It allows for a little bit of the shock absorption. Actually, the spring, your curve in your back and your neck and the spine, those are actually more of the shock absorbers. If you have a good curvature system in your body, that's going to actually absorb the shock and then bounce back, right? Think of it like a coil. It helps to absorb and then bounce. The disc actually helps to create space for the nerves, but it also helps to allow for mobility and function in the joint. But you can see this disc here is starting to thin out pretty significantly. So that happens over, this severity, I would probably say at least 10 to 15 years it's been like that for it to get that much loss of disc height there. Now the concern is that you have that space where those nerves come out of. They're nice and big up on top. This joint's one, it's getting smaller, but then two, you're getting a bone spur that's kind of developing into that space. So that makes sense where you're like, oh, it's like a sharp pinching there. Right. I would probably say with the fourth lumbars and that sacralization of the L5, I'm pretty sure you just add more fuel to the fire by some of the activity that you may have done when you're younger that contributes to this wearing of that disc. So that's why we do x-rays, because I want to know exactly what's happening to the spine. I can't tell you exactly the history of what caused it,
right,
but at least I can tell you what we need to do to fix and address what's going on there. So this stuff, it's been there for years. And obviously in an ideal world, if all things were perfect, you would have taken care of a lot of this stuff when you're younger.
Right.
But 2020, hindsight's 2020, and you can only deal with what you have available now. And so I'm glad that you're here. Your neck's actually looking pretty clear here. We got a little bit of the base of your neck. So even though you have disc degeneration on that mid to lower part of your neck here, it's your upper thoracic that we're going to see a lot of that stress coming into play.
It's a little tender.
A little tender there. We got this one right here.
Yeah.
That's the one that's most. So this is your L5. That's the one that's sacralized or kind of fused to that sacrum.
When we go back a little further, that's when I feel it.
That's where you feel it?
Yeah.
And I want to go up a little bit higher. That's your L4 right there. Okay. So we're going to start with that L4 here. I think that's where you're going to see a lot of that stress. 4, 3, 2, 1, 12, 1, 10, 8, 1, 2, 3, 7, 8. Here's 8, 7, 6, 7, 8. Any pain or soreness?
That's so weird because when it's not necessarily there, but when you do that, I feel something here.
Okay, gotcha. So I'm just gonna take a look here. So what I'm doing is looking for swelling. We call this pitting edema, where you get a little bit of pool of fluid right there is where it's at. So where that inflammation starts to accumulate, you're gonna see a little bit of a dip, and it's right here.
Usually when I get neck pain, I usually get it right at the base.
Up at the top
on
there.
the left side, yeah.
Yeah, I could see that. Yeah, you do have some stress up on the top, but right now your neck's looking pretty clear, and as it's shifting forward, it does kind of lead me to look at your base of your neck. So sometimes when you have an issue down here, it can create stress up into the top because those trap muscles, they're getting real tight, real tense, and those muscles attach to the base of the skull. So where you feel that pressure up on the top, it might be coming from the base of your neck there.
Interesting.
2. So real quick here is 2, 3, 2, 3. No tenderness, right?
Not really.
Looks like 3 is where it gets stuck. Yeah, we're gonna start with here's 3. We're gonna go to here 6, and then we got your L4 right on over here. Take a look here. Okay.
I do know, like, if I pull my leg forward right about here, that's as far as I can go because it starts pinching really bad.
Right in that area.
Yeah.
Okay. Now, when you say pinching, it's more in this area.
Right.
Okay, not as much up here.
Not as much there. It almost feels like my tailbone, but that could just be the way it radiates.
Mm-hmm. So we're going to stick to your 4. So the good thing about what we're going to do, because I'm not going to just crack a bunch of things up and down your spine. So when I work on something, I want to know exactly where I'm at, and I also know exactly what I did. So when you come to me next visit, what I'm going to assess is see how you're progressing. If we're doing pretty well, we're on the right track, we're going to stick to your L4. If for some reason we're not seeing as much improvement as I would like to, then we're going to move down to the tailbone. But for right now, I want to stick to your L4, get them pressure off of that, and then we're going to take it one step at a time. So I don't know what exactly happened to the last time you went into a chiropractor. I don't expect any blacking out today, okay? So you're going to be just fine around here on that right there. All right, good and good. But yeah, after we adjust you, though, you tell me how you feel, okay?
Okay.
All right, so I'm going to scoot you forward just a little bit. Right there, this leg straight. Going to roll you quite a bit. Good. I don't want to twist you. I'm just going to go ahead and set you right here. I'm going to give a bit of a push here, okay?
Good.
Relaxing that shoulder. Nice. And you might be a little tender, okay? Good. Right there's perfect. There you go. Good. Nice and easy on that. Good job. That's set real nice.
Yeah, nice crack.
Yeah, that's a good crack. All right. You doing okay?
Yeah.
All right. Come on up. Have a seat. Until 2, 3, or 4, 5, 6. All right. Breathing in. I'll let it go. Relax that shoulder on the right. Nice and easy on that. Good job. So this part of your spine is where it kind of goes to that left side, and then it starts coming back. So that moved pretty well. Now we're going to do your T3. You doing okay still? All right, we got one more. 1, 2, and then 3. This one we're going to have to go right on over here. Get a little bit of a push. Good. You're going to breathe in. Let it go. Drop in the shoulder. Ooh, that was stuck. Relaxing that shoulder. There it is. Okay. So we're going to see how you do with that. First of all, how you doing?
Good.
Okay, you're not too bad?
No.
All right, good.
No, I still see color and have my vision.
Good.
So to get the curvature from my neck back to where it needs to be,
Yes.
is that just from consistent adjustments?
So there's a 3-step process that we take in our office. So first we do mobilization by structural corrections of the spine, doing the adjustments. The second is flexibility, stretching the ligaments and the muscles. And then the third is going to be strengthening it. Now, one key component that I will mention is that we all have bad habits, right? So bad habits are going to be things like cell phone use, computer use, just if you're doing stuff.
I have a lot of that.
Okay, yeah, if you're looking down quite a bit, that's going to put more stress. So the more we can reverse some of those bad habits, the better it's going to be for your spine. Because I can do amazing work on the body, but if you're not actually doing the stuff you have to do at home, then this stuff isn't going to do you any good, right? As much as I think I'm an amazing chiropractor, I'm not that great if you're not doing anything good.
Right.
So one of the things we tell patients is that the word doctor means teacher in Latin, which basically means that I need to teach you stuff that you need to do outside the office that's going to help you out. And that's going to be part of the process. As we go through the treatment, we're going to give you little bits here and there to help you to reverse some of the stress back at home.
Can some of this be hereditary? Because I know my grandmother and my dad, they're all hunchback.
Yeah. Yes, it can be partly genetics, but most of it's going to be diet and lifestyle that's causing a lot of the stuff that we're developing here. Good. Okay, so we're going to leave that alone. I think that moved really well. Actually, you got some really good adjustments in your entire spine.
Yeah, I mean, I noticed I can turn my head a little more now. I think I was stuck at this point, but now I can turn it over a little bit more.
Yeah, that's awesome, man. And we didn't even touch your neck. We touched the upper part of the thoracics. And so as we continue to work on some of that stuff, we might need to move into your neck as things start to shift, move, and change. But for right now, we just target the areas that we see where there's inflammation and temporary, the places where the subluxations are. But in terms of that, the little bits of correction here and there is going to make a big difference later on.
Okay.
Any
Thanks.
questions for me right now?
No. You're taking care of everything.
Awesome, man. Well, let's see how things do. And then next time you come in, hopefully I'll hear some good news.
Yeah.
All right,
Excellent.
man.
All right. Thank you.